Hi everyone, Dr. Carri pelvic floor physical therapist at Recharged Therapy, here with you today to talk about pelvic floor therapy for men. I see a good number of men in my clinic for pelvic floor issues. So I've had 17, 18-year-olds up to like 80-year-old men. So originally, when I started doing pelvic floor therapy, most of my male clients were coming for bladder leakage after prostate surgery. That was like the most common thing I saw. And I still see that, but now many more men are coming for pelvic pain. And I think one factor has been the pandemic, the after effects of the pandemic. So I've seen some men with long COVID pelvic floor issues, but mostly it's just sitting long hours, working from home, working from a less than ideal desk setup, and just less movement. So I think that's a big factor. That's a common thread I've seen. Also, some of my colleagues have said they see a lot of young men who are video game players, sitting for hours, and then like the game gets tense and they get tense. So most of my male patients now are coming for pelvic pain. Very rarely lately do I see them for incontinence or constipation. Like I said, earlier in my career, a lot of men after prostate surgery. So definitely if you have prostate surgery, you should be seeing a pelvic floor physical therapist. It takes a while to get bladder control back and to get it 100% back, but pelvic floor therapy has been shown to help, and I've seen it in my clinic too. But let's talk today more about pelvic pain. So I'm going to show you a model of a male pelvic floor. So if you don't want to see it, look away. But this is looking from the bottom. This is literally the bottom. And here's the rectal opening. Here's what would be underneath the penis. And all of these muscles, and even up here, are pelvic floor muscles. We generally don't work on the shaft of the penis, but we work at the base, this triangle here of muscles, and then sometimes we'll work rectally. So with my patients, I usually start with working outside, feeling these muscles, and then for some, if it's appropriate, we work internally rectally to feel these muscles better in there. But the muscles are the same as they are in the female. It's just less common because there's less openings disrupting the muscles. But a couple of common things that I hear from my male patients is one of the most common things I hear is it feels like I'm sitting on a golf ball or an egg or a ball. And I'm going to show you the model again. So that's usually like right in here. So not along the penis and not on the rectum, but kind of right in between. They usually say it feels like I'm sitting on something. For some of my males, it manifests as more like tailbone pain. And then also, I would say a lot of them have penile pain or difficulty or pain with erections, ejaculation. Sometimes it comes as urinary frequency, urgency, or urinary hesitancy, but often there's like I constantly feel like I need to go to the bathroom. That's a common symptom too. And most of these symptoms are due to tight pelvic floor muscles, not weak pelvic floor muscles. Sometimes they're weak, but generally it's tightness. And the other things I look at in my male patients is how flexible are they? So a lot of them are not flexible. And so if the spine isn't flexible, if the hips aren't flexible, if the legs, the hamstrings aren't flexible, then it's kind of pulling everything on the outside. And so that's going to feed into that tightness on the inside muscles. So a big part of my treatment for men is working on flexibility, mobility, getting things surrounding the pelvis to move better. And then we do work directly on the muscles, either like release work by me working directly on them, working on deep breathing exercises to help relax the muscles. So yeah, that's basically pelvic floor therapy for men. But yeah, a lot of men, how do they get here? I have bladder issues, I thought I had an infection, I thought I had a prostate problem, I've been to the urologist, they did all these tests. Often the diagnosis they get is called non-bacterial prostatitis, which just means like inflammation but without an infection. Basically, doctors are like, we don't know what to do with you, so yeah. But what they should be doing is sending you to a pelvic floor physical therapist, because that is the treatment for those symptoms if there's no infection. So yes, go see your doctor, go see a urologist, get tested. We want to make sure it's not an infection, it's not prostate cancer. Prostate cancer is very, very, very common the older we get. Like every decade of life, 60, 70, 80, like the chances of having prostate cancer is very, very high. But prostate cancer is very treatable. So get your checkups by your doctor, because if prostate cancer is caught early, it's very treatable. But if it's not caught early and it spreads, then it's much harder to treat and the survival rate goes down significantly. But if it's caught early, I think it's a simple blood or urine test. I'm not sure which, but your PSA levels. Yes, so get checked out medically. Always encourage people to get checked out medically. But if it's not a UTI, a bladder infection, a prostate infection, prostate cancer, and you get diagnosed with non-bacterial prostatitis, go see a pelvic floor physical therapist. There's help, there is hope, and my male patients do great. And usually after a course of physical therapy, it's probably on average 6 to 8 visits. They have no symptoms. They're living their life. They're exercising, they're running, they're lifting weights, they're working, they're having sexual function restored. So there's hope. There's help. So find a pelvic floor therapist near you.